right? Yeah, let's talk about other tests as well that just perhaps, Chad, that you think of that have real good support. Maybe more of us should be aware of. Anything come to your mind?
Well, there are two that I will frequently call unicorn tests because they, in study after study, different populations, different settings, they still do well. And one is called the pubic percussion test, and it's a test for a hip fracture. And it could be a test for a pelvic fracture as well, but essentially what you do is you put a stethoscope on the pubic symphysis of the patient, and then take a tuning fork, tap it, and put it on the kneecap of the patient and compare one leg to the other. And it's amazing. You can hear the ringing from the tuning fork as it goes into the stethoscope. And of those individuals who have a hip fracture, not a stress fracture, but a true hip fracture, you'll hear a difference in sound. It'll be attenuated on the side of the fracture. Another one is the cervical rotation test for the cervicogenic headache condition. And it's been studied about 6 times now. And it is both sensitive and specific for a cervicogenic headache. Now, some of the tests have a little bit higher risk of bias because there's not a true gold standard for cervicogenic headache, which you might see with a fracture, that being an X-ray or rotator cuff tear that would be arthroscopic surgery. But that particular test does fairly well in all subsequent studies, regardless of who does the study, regardless of what type of clinician they are. It does fairly well.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.